Okay, so in this lab or pre-lab, we are going to start with the muscle. Okay, so what you will notice is we finished up to chapters 10 on your manual, but we are going to go into chapter 12 now. Doesn't mean we are skipping 11 altogether. I'm just rearranging it. We'll come back to 11 later because it's muscle physiology. And as such, what's on your manual, we're not going to go through all of it. And so only a little portion of it. And so I'm going to put it with the neuromuscular junction part. So we are going to do today's lab, which is March 2nd, right? We are going to cover chapters 12 and 13, which are basically your muscles of the shoulder and arm, and then hip and hip, legs, and feet. But then your head and neck, and then your muscles of the thorax. Those kinds of things we'll do in the next lab once you come back from your spring break, and then later we'll do the neuromuscular junction and then move on to brain and so on, right? And therefore, right now, I just want you to focus for this lab on chapters 12 and 13. Okay, so once again, just like in your skeletal system, I want to give you a forewarning that there's going to be a lot of names, okay? And there's very little description or descriptive part that I can actually teach you, like, concept or something like that. So it's mostly memorizing, looking at the models, looking at the virtual dissection that I'm going to give you, looking at the pictures on your manual, and models, of course, you can see in the class, and then identifying what muscle, which is what muscle, right? And so please be ready to a lot of memorization, and don't put off the memorizing part till the last minute, right? Start studying, right? Look at, and then form little groups and test each other. Hey, what is this muscle? What is that muscle? Like that, right? And so that's how you're going to learn. All right. So when we go into muscle, we are going to also, first, before we go into detail about each muscle and stuff, you're going to first understand that the muscles have a very specific way of being identified, right? We're going to come to the ways of identifying them, but also, like, they have their own structural elements, anatomical elements. That means each skeletal muscle, we are only talking about skeletal muscle now. We are not talking about cardiac or smooth muscle, right? So in the case of skeletal muscle, generally we have a part of the muscle. It's not all uniform in its function or in an anatomical context. So generally a muscle has an origin, and this origin is the part of the muscle where it is not going to be moving. It's like where it is kept fixed, right? And then the muscle, then you have the muscle part, and then the other end of the muscle, that part is called insertion, where it is going to be connected to next tissue, but that is where you moves, right? So during contraction, I'm not talking about just moving like this. I'm talking about contraction, right? So the muscle is going to be contracting and relaxing, contracting and relaxing. The origin part of it is not going to be moving very much during contraction. However, the insertion part is, okay? First thing is that muscle, right? It doesn't move on its own, right? It's not like inert and it is unconnected to anything. It's not an isolated entity. All muscles are being innervated. That means they get the signals from a particular nerve, right? So from your nervous system. And so that term, learn that term, innervation. So if you denervate, that means you're taking off that nerve signal. That means the muscle loses its command, right? It's nobody's giving it command, so the muscle becomes flaccid, right? So for example, when people have spinal cord injury, right? So let's say they get injured in their cervical spinal cord. For one of the nerves there, right? It's called phrenic nerve, and that nerve actually innervates muscles of the face, right? And muscles of the diaphragm. So muscles of the face, if people can't move, they're not going to die, right? So they can't smile probably. But if it is the diaphragm, which is like one of the most important muscles for respiration, if that muscle is not innervated, right, naturally you can't respire. So you're at the risk of dying. I'm saying at the risk because phrenic nerve has two branches, so it comes from both sides. So it's unlikely both of the nerves can get denervated, like they lose their function because of, but it is also likely, right? You don't know what kind of injury. If that happens, then the person is at the risk of dying. So generally those patients are put on artificial ventilator because something has to tell them otherwise. And so even then the muscle is not going to be working, diaphragm muscle. So they're going to be in coma. So when the person comes back from coma, if they come back from coma, then they actually have to learn to use the diaphragm muscle for respiration. It's a very, very big thing, right? Because the muscle has forgotten 2 months, 3 months, when for whatever length the artificial respiration was given, the diaphragm muscle basically forgets that it was actually getting nerve input, innervation signal from the phrenic nerve, and it was supposed to contract in response, right? So that is the example I'm giving for you to understand that muscles work under the command of the nerves, and that process we call it innervation. So later when we study the nervous system, we'll study how cranial nerves and spinal nerves basically are going to go to different and innervate different muscles, different parts in the different parts of our body. Okay. Muscles are generally named. It's pretty reasonable, right? So the category, but there is a little bit of a problem, and that is there are many ways to categorize. It's not just this is the muscle of the forearm, and that is because it's on the forearm. We'll call it forearm muscle. Not like that, right? So there are many ways to categorize or identify the muscle. So your manual actually lists some of them, like location. So tibial anterior muscle. That means you can immediately say, oh, okay, so it is right next to the tibia in your leg and in the anterior position. Okay, location tells you what kind of a muscle we are talking about. Or temporalis. Oh, okay, it's next to our temporal bone, right? So you can, if you know the skeletal system, you can immediately tell the muscle. Other way to identify is the size of the muscle, right? So gluteus maximus, your butt muscle, right? Basically, that is maximus, it's big. There is another muscle called gluteus minimus, that's a small one in that bundle of many types of muscle that are actually attached to your butt. One is a big one and one is a small one. Right? So maximus, oh, that must be the big one, maximum, right? Then you can have a shape based on the shape. Sometimes muscles are named after the shape. That first person who identified said, oh, it looks like this shape, so I'm going to name it like that. Your deltoid muscle, right? So it's a delta was for triangle. And so it had a triangular shape, and then they said, okay, we'll call it deltoid, like that. And then you have orientation, like in your thoracic muscles, right? We'll study about that in the next lab. But there is a muscle that's like, you have muscles like going this way and this way. Then you have one that's sort of like a horizontal, right? And so you call it transverse muscle because the orientation of the muscle is sort of like not in parallel with the rest of the muscles, but it goes transverse to them, right? Or perpendicular to them. Then you have origin based on, you can categorize based on the origin and insertion. So you can say, oh, okay, there is a muscle called flexor hallucis, right? It inserts into the muscle of your big toe called that muscle. Big toe is called hallux, right? So this muscle is called hallucis because it inserts into the big toe muscle, okay, or into the big toe. Then you have number of heads. So the muscle itself, right? It can have, it will be a one muscle, but then you can kind of identify 3 heads or 4 heads or like that. Your triceps has 3 heads, biceps has 2 heads, like that. And then also you can categorize or name a muscle based on action, right? So is it extensor, you're extending, or you're flexing, flexor muscle, right? So based on that, you can say it's an extensor, blah, 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 or is it extensor digitorum, for example. So muscles that help you extend your finger or flex the finger, right? So flexor digitorum or extensor digitorum. So usually flexors and extensors are going to be complementary. You'll have a pair of them. So because we are able to do both, right? So that's what. And then you have the length also. Sometimes the muscle length, just like the size, right? Magnus and minimus, or maximus and minimus, you can have longus and brevis. Brevity, the word brevity comes from, or brief, comes from, I think it's Latin for short, right? And so brevis muscles usually are shorter, longus muscles are longer. So when you're studying these things, take note of these things, right? Those are going to be helping you. Oh yeah, okay, now I remember it is something to do with long, something to do with where it is inserted, like that, right? So those will help you remember the muscles. Okay. As we studied before, skeletal muscles are voluntary muscles. That means you have the control over moving them, contracting them. Okay. So first part, that is in your chapter 12, are the muscles of the shoulder, and then muscles of your arms, right? Hand and arm, right? So like I said, all of it is going to be just names, right? So you got to learn them. So let's, so basically when you look at it, even though this 12.1, right, picture 12.1, it's in this page, the anterior, then the next page, we have the posterior of the whole body, right? But you don't have to, right? The posterior, but right now we are not going to learn all about it right now, right? So we're going to only limit ourselves to the shoulder and to the arms, right? So those two figures are very important. Basically, it's one figure put in two pages. So learn that. And then I'm going to do the dissection just now and show you a virtual dissection, and so show you how to identify or what muscles you should be identifying. All right. So let us, so we are starting with the shoulder and arm, okay? And let us see what anterior, let's go with the anterior. So you see the body there, that's great, cadaver. And so we are first making our first incision. We have taken out the epidermal layer and so on, and you already start to see the muscles. Very nice. Okay. Now, what are these muscles? So these are going to be part of your neck and shoulder, right? Sort of muscles. This is your shoulder joint toward your arm, and this is pectoralis major. We'll come to it later in the thoracic area also. So you already start to see this is part of your chest region. So this one is very important. Sternocleidomastoid, right? So that is in the sort of like when you move your neck, it is attached to your front of your body, right? Sternocleidomastoid. Okay, that is your trapezius muscle. So that is right on your shoulder, right? Little towards the back, but there, that's your deltoid. So you see that it's triangle in shape, right? Very good. So these are superficial muscles. So immediately after the first level of dissection, you can start seeing them. All right, so we are going to move on. So we have dissected further. What do we see here? So that is the pectoralis minor. As you saw, pectoralis major was sort of on the top and pectoralis minor is attached. So now you can start to see how the bones and different parts are attached by muscle, right? So that is your short head of the biceps. Like I said, biceps brachii, that's an anterior portion of your forearm. That has two heads. That's why it gets biceps, right? So that is a short head. That's a long head, right? So that and that belong to this muscle, biceps brachii. So that's a long head, that's a short head. And that's the biceps brachii muscle. YUM stands for muscle. All right, we dissect further. What do we see? This is from the back, right? So this is subscapularis. So you can immediately say, oh, that must be close to the scapula. And that is right. So scapula, that's a bone at the back of your shoulder, right? And there, right next to that, right? Below that, you have the subscapularis, Coracobrachialis. This is a different muscle. You won't see it because it's sort of hidden underneath your biceps. And so after that level of dissection, you can start see this. This is called coracobrachialis, right? So if you remember, the scapula had that two things, right? Remember, coracoid process. And so this one is going to attach to that, okay? Then you have teres major, latissimus dorsi. This is also going to be in the backside. Serratus anterior. This is on the front, right? So it's part of your chest muscles, thoracic muscles. External abdominal oblique. And you can now see the position. Based on the position, you can label, right? Label a muscle, right? So see, it's a sort of oblique sideway, right? Like a little angular, in a slanting angle. It's oriented. So it's called oblique muscle. It's called external abdominal oblique muscle, okay? That is brachialis. This is different from biceps brachii. So you have to understand the difference. So if I put this in the exam and then you identify it as biceps brachii, you won't get any name, any mark, even though you can say, hey, the brachii is kind of common. No. This is brachialis, totally different muscle. And that one was biceps brachii, okay? This is brachioradialis because it is going to be close to the brachii, and it is actually attached to the radius bone. All right. Okay, so that's the last dissection part. You get the all the skeleton there. Okay. Let's see what is going on in the posterior side here. Okay, now this is the back side, right? And so you can start seeing the elbow and everything. All right. That's your deltoid. So again, that is the triangular part. That's your trapezius muscle. Like I said, we saw it from about the little part of it already, from the front. Okay, so that is their levator scapula. Again, this is another one based on the action, the name. Levator, levitation. You can think of it as elevating, right? And so this is going to be attached to the scapula. And this is the muscle which helps you, shrug your shoulder, right? So very common among you guys, right? Teenagers, when your mom says something, and your teacher says something, and that you do it because of the levator scapula muscle, right? So that is the one there. And then that's rhomboid. So this one also based on the shape, rhombus, right? It's sort of like a parallelogram, four-faced thing. And so you can see that muscle is a little like, like a rectangle, but a slanted rectangle, right? That's why it's called rhomboid minor, rhomboid major. So this is going to be thicker than that. All right, infraspinatus, right? Infraspinatus muscle, and teres minor. We saw that one, which was showing from the anterior view. Teres major. So that is teres minor, teres major. Lateral head of now at the back side, instead of the biceps, we have triceps, which has 3 heads. So that's a lateral head, right? Long head, tricep. So the whole muscle. We don't see the short head of the triceps here, but it's there. So this is your triceps muscle, right? So this part. And then medial head of the triceps brachii. Okay, very good. That's a supraspinatus. So this is sort of was hidden. Earlier we saw the infraspinatus. Now that is a supraspinatus. And when you take that, dissect off, you get to the skeleton. Very good. So that was shoulder and arm. Let's go to forearm and hand. Okay. So that's your hand. Very good. What muscles can we identify here? So that's going to be a biceps. This is anterior view. Okay. So from front when you see. Okay. So it's going to be here. That's your biceps brachii. Basically, that's a bicep muscle. Brachioradialis, right? So that's going to be attached to your radius. Palmar is longer. So that is going to run directly to the palm, as you see, right? So that's longest because it's a long muscle. Then you have flexor carpi radialis. So now you know it's carpi. That means it is going through the carpals. And then it is radialis because it's connecting also the radius part of the forearm, and it's flexor. So that is the muscle that's involved in the flexing of your arm, like that, right? So, and then flexor carpi ulnaris, same way. This is a bone that runs between your ulna and the carpals, and it is involved in the flexing of that area. Okay, that's palmar aponeurosis. So palmar, basically, that's in the palm. Palmar aponeurosis. So next level of dissection, what do we see, right? So you can already start to see, because you're already cutting through the thing, you can start to see some of the posterior bone, muscles there. So you see the triceps brachii, brachialis, now it is becoming more evident, right? Brachialis, pronator teres. Again, this is another one, pronation and supination. Remember the first lecture, right? So if you lie your hand like this with the back on the floor, right? That's your supine position. But if you put it like that, that's pronation, right? So the muscle that helps you go to the pronator, right? So that is prone muscle orientation. That's your pronator muscle. Here it is called pronator teres, supinator. Okay, so usually like they both go together because they're complementary actions. So if you want to move your hand this way or this way, that muscle will decide, those two muscles. Flexor digitorum superficialis, again, this muscle is going to help you flex your digits. Okay. Flexor pollicis longus, right? So just like hallux is your big toe, pollex is your thumb, right? So flexor pollicis longus is going to attach to your thumb, so it is going to help you flex your thumb like that, right? I'm not like this, but like flex, right? Contraction, contractor. Extend is when it is relaxing. So for that muscle is going to run like that, and as you see that. So that flexor pollicis longus. So there's three descriptions there. Flexor digitorum profundus. The earlier one was superficialis. This is profundus. So this is deep. The other one was superficial. Look at that one, pronatus quadratus, right? Pronator quadratus. So this, look at this. This is a very unique muscle because everything was running like this parallel, but suddenly it is in a transverse way, like, or a perpendicular way. And also it's called a quadratus because it's a quadrangle shaped, right? A four-faced shape. So that is why it's called quadratus. And then you reach the skeleton. Let's look at the posterior of this. So now we are looking at the posterior side of your arm. What do we have here? Okay, so that's your brachialis. That's your biceps. So you can see the brachialis and biceps together. And so you can say, oh yeah, okay, so what is their relationship? So they're next to each other. Sometimes from some angle, biceps is actually going to be hiding this brachialis. So that's why we need to do the dissection and also different views. And so you can see them properly. Brachioradialis, you already saw that. So when your hand is like this, you're going to see it here, brachioradialis, right? That's your extensor carpi radialis brevis. So that's now 4-1. It's in for extension. It is going through carpal and radius, and it is short, brevis. Okay, and so that one is here, right? Short one. Okay, extensor carpi ulnaris. So again, it helps the extension, and it attaches to both carpals and ulna. Extensor digitorum, extensor digiti minimi, and then extensor capri radialis longus. So carpi radialis. So this one was same thing, brevis, right? So small muscle, right? So shorter muscle, but this is the long muscle. This one, this whitish thing, that's your long muscle. So we dissect more. And then what do we see? We see the supinator muscle there. So it helps to put the hand in a supine position. And abductor pollicis longus. Okay, so you will come across these also when we learn how we move our body, right, or the joints based on our muscles and bones and stuff. So there's a particular action called abduction. So abduction, oh my God, kidnapping, and that is true. Abduction means taking away. right? And so when you're standing like this and you move your, let's say you're like this middle position and you move your right hand or right leg away from your body, that movement is called abduction, right? If you bring whatever was there and you bring it close to, that's called adduction. So right now, abductor pollicis longus is going to be, you have your hand like this, right? And then your thumb, pollex, you move it away from the rest of the hand. That's a movement, and it needs a specific muscle to do that action. And that is your abductor pollicis longus. It's a long muscle that helps move the thumb away from the rest of the hand. Extensor pollicis longus, again, it's related to the thumb, but it's a long muscle and it helps the extension of the thumb. Extensor indicis, basically it's for the index finger, and as you can see, it is actually attached to the index finger, right? Extensor pollicis brevis, it's a short muscle that does the same. All right, so we then go to wrist and hand. Okay, this is in the anterior angle. So what do we see here? This is the tendon. This is not the muscle. Tendon of the palmaris longus. That's the palmaris aponeurosis, which we saw earlier. So that's in the middle of your hand. Okay. So abductor pollicis brevis, right? So we saw the longus earlier. So that's the brevis. So it's going to go like here, right? And so it's going to go and attach to your thumb. So it's going to help move the thumb away. Thenar muscle, so that's actually a bundle, muscle bundle. Thenar region, it's actually on your book also. Thenar, let me see, where did I see that? Somewhere I saw that, but I'll come to that later. Anyway, flexor pollicis brevis, right? Flexor digitorum superficialis, hypothenar, right? That's your abductor digiti minimi, muscle of the hand, flexor digiti minimi, brevis of the hand. Okay. Oh, we did that. Okay. Opponent's pollicis, right? And so that is also attached to the your thumb. Okay. Flexor pollicis, lumbrical, that's a bundle actually, lumbrical muscle of the hand, opponents digiti minimi, and then tendons of flexor digitorum. So when you remove the muscle more and more, you can start to see the tendons that connect the muscle to the bone. So that's your adductor pollicis, right? Like said, if you move away, that's one movement. If you bring it closer, that's another movement called adduction. So we use different muscles for different movements like that. That's your pronator quadratus again, right? So you see that quadrangle shape of the muscle there, and that helps in the pronation of the hand. The tendon of the flexor pollicis, and then you basically have the bone there. Posteriorly, what we have here. So that is still your pronator quadratus. It sees very nicely, right? It's like a band around your wrist already. So we have a muscular band there, right? So we do that. And then what do we see here? That's your extensor digiti. Abductor pollicis longus, we saw that before. Extensor pollicis. So some of these are basically repeats, but then you can see it in different detail with the different details in different angles. That's why I'm showing all of this. Extensor pollicis, a tendon of the extensor carpi radialis. Then you have the extensor carpi radialis brevis, right? That's a tendon for that. Then you have the dorsal interosseous muscle, right? So you see that only from the posterior angle. So you have what is called an interosseous muscle of the hand that is like sort of in a deep way in here, right? Underneath. So, and you see it only on the back side of the hand. Okay. Extensor indicis, once again, it is for the index finger. And it helps the extension, like relaxed way, right? Flexing will be like keeping it very rigid, but then extensor is going to be extension of the hand, the finger, extensor digitorum, extensor expansion. Okay, and when we do that, you get the skeleton. Fine. Hip and thigh, are we doing that? Yeah, so basically, those are the muscles that you need to learn for the hand, wrist, and everything. And then you have your, let me see, tables. Your book actually does a very good job for the tables. So let's look. Table 1, right? Table 12.1 summarizes the muscles of shoulder, arm, and forearm. And then table 12.2 summarizes muscles acting on the hand, right? So you have to study all of those things. Starting on page 178, you have cat dissection. You do not have to worry about it. So that goes for a couple of pages. So you don't have to worry about that at all. No cat dissection. Then we move to exercise number 13, which is basically your muscles of the hip, thigh, leg, and foot, right? Then we start with the pictures there again, and then there are tables 12.1, 13.1, and so on. And so it goes from your thigh, muscles of the thigh, muscles of the muscles of posteriorly, muscles of your hip, and then your leg part and the foot, right? So same way, same, just like in chapter 12, starting on page 202, you have your cat dissection. You can completely omit that. Okay, so let's go and look at the hip and thigh muscles here. Anteriorly, what do we have? Okay, so so that you see the thigh muscle here and part of the hip already here. That's a part of your hip, right? And so we will look at the muscles at the posterior side in just 1 minute. Okay, so let's start dissecting. So we are doing the right side. Okay, so there you started this. So this is called iliopsoas. So that is, if you remember, close to the ilium, right? The pelvic in the skeletal system. So iliopsoas muscle, it's a very, very important muscle. And then you have a tensor fasciae latae. Oh yeah, this one in the superficial level of the thigh, you start to see this. So it's called tensor, right? Fasciae. Fascia is usually fascia is like a bundle, like a big, thick sort of thing. And then latte, right? And then you have sartorius. This is a very, very easily identifiable muscle, and it's like a strip, like a ribbon, like that. So you can actually see it in your page or figure 13.1, right? So that muscle, right? So that I hope you can see that. So that ribbon-like muscle, that's your sartorius, that one, right? So it's very easily identified muscle, identifiable muscle, okay? Rectus femoris, now we know, that's a femur muscle, right? Femur bone attached to that, okay? So that is rectus femoris and quadriceps femoris. So that's your quad muscle, right? So that's like one of the biggest muscles and one of the strongest muscles in your body, the quadricep muscle. And then you have your tendon of the quadricep muscle. So as you can see immediately, tendon usually is like, like a yellowish and stuff, and not like the muscle, fleshy with a brownish color. Okay, that's the tendon for the quadriceps femoris. Okay, what do we see after that? That's your pectineus muscle, right? So that is beneath the next layer. Vastus intermedius, adductor longus. So when you're, if, this is your central medial line, and let's say this is your right foot, right thigh, right? So if you're bringing a right thigh like that toward your median, that is an adduction movement, right? And that's managed by a couple of muscles. One of them is adductor longus. So it's a long muscle there. Then you have a gracilis, and that is, you can see also gracilis is very thin, and you can kind of associate it with graceful, right? Very slender sort of a muscle there. Okay, vastus lateralis, right? So you had the vastus intermedius, that's in the lateral, right, away from the median, lateral, vastus lateralis, That's your vastus medialis. So you have intermedialis, medialis, and laterus. That's your adductor brevis. I told you adduction manages a couple of muscles, right? Adductor longus, and then you have adductor brevis here. Both of them are for the adduction movement. Adductor magnus, so it is bigger one, so very, very big, magnificent, right? So you can attach these names or words to understand these things. Interior, you have your obturator externus, right? So that is the obturator. Remember the obturator foramen in the pelvis, right? That we saw in the skeletal system. This is attached to that area, right? Obturator externus. So when we cut through that, we reach the skeleton. So we'll go to the posterior now. Okay, so as you see, that's the butt part. This is the back of your thigh, back of your knee. This is the back in the back side of the body. Okay, so we are going to do the same thing. We looked at the right thigh anterior. Now we are going to stick with the right part. So we are doing the posterior side of the right leg, right? Now, what do we see here? That is your gluteus maximus. That's your butt muscle, right? With which we sit, which forms the bulk of our buttock. Okay, iliotibial tract, right? So that is that part. Okay. Now you start to see nice muscles there. Okay, what do we see here? That is gluteus medius. So gluteus, you have three: gluteus maximus, gluteus medius, then you have gluteus minimus. So that is your gluteus magnus. Then you have piriformis, right? Then semitendinous muscle and long head of biceps femoris. So you have four for quadriceps femoris, then you have biceps femoris. Biceps femoris is at the back, quadriceps is on the front of your thigh, both attached to the femur, right? Gluteus minimus, right? So you had the maximus, magnus, and then the minimus. Obturator internus, we saw the externus on the other side, right? Anterior, superior and inferior gemellus, quadratus femoris, semimembranous muscle, short head of the biceps femoris. All right. Hip and thigh, leg and foot. Let's go for that. Anterior. So this is also right leg. So you finished with the thigh there, knee part, leg, and then your foot, right? So that's great. Let's start dissecting, right? And what do we see here? Tibialis anterior. Tibialis anterior. So attached to the tibia, and we are that muscle is actually, it's not just because we are looking at the anterior view, but this is actually a muscle that is in the anterior portion of the leg. Okay. Fibularis longus and brevis. That means this is like a bundle that has both the muscles there. Okay, both longus and brevis, and it's attached to the fibula. Okay, extensor digitorum longus, right? So that means it is going to help in the extension of the digits, right? And it is a long muscle. Extensor hallucis longus. Wait a minute, what is she saying? And look at that muscle. It is actually going to attach to your hallux. That's your big toe, right? So that is very specific. So it's not just any digit, but actually to the big toe, helps that in the extension of the big toe. So that is your extensor hallucis brevis, again attached to the hallux, but it's a shorter version of that. And then extensor digitorum brevis, and that is going to go to the digits. Posteriorly, same right leg, but we are looking from the back side. That's your gastrocnemius, right? So calf muscle, right? So at the back of your muscle, that's the gastrocnemius. So this is a most important muscle for walking. So if you have a nick injury to this muscle, you absolutely cannot walk. Okay, so it's easily identifiable and very, very important for walking. And then that is your calcaneal tendon. Remember, this is your calcaneus bone. And so that is the tendon that attaches muscles to that bone. That's the plantaris. That's the soleus. So gastrocnemius is it's like a really when people exercise very well and everything, it gets really toned, right? So it's like a nice bubble like area, and then hidden underneath sort of is the soleus muscle. So it's a little difficult to identify it if you just look at the gastrocnemius. But if you're dissecting, you just remove the gastrocnemius a little bit, then you start to see the soleus muscle there because it's a little bit thinner, right? That's your soleus. Popliteal, so that's the one that is right, and you can see it's right next to the knee, right? So it's at the knee part of the thing. So anything popliteal, knee. So there's an artery that runs next to the knee. That's popliteal artery. This is your popliteal muscle. Tibialis posterior. We saw the tibialis anterior. Now it's in the posterior, underneath it, backside. Flexor hallucis longus, flexor digitorum longus. And you get the point. Lastly, foot. Okay, so we are looking from here. Okay, plantar view. That means from the sole of the foot. Plantar aponeurosis. Remember, like your palmar we had in the hand, right? In this bundle. So here it is plantar because it's in the sole of the foot. Aponeurosis. Abductor, digiti minimi, right? That's the smallest toe, right? Abductor. So you can move this one like that. This is the one muscle that's going to be involved in that action. Flexor digitorum, that means it is probably going to go to that one, right? Then that is your abductor hallucis. Naturally, that is going to go like that toward your hallux. Next level, right? Lumbrical, that's the muscle bundle of the foot. Tendon, and as you see, that's not the muscle, right? That's the yellowish things, tendon of the flexor hallucis. That's the tendons of flexor digitorum, quadratus plantae. So that is the plantar part of the foot again. And that was actually, what was it? So that is a quadratus. So it's sort of like an irregular four-sided rectangle. All right, what do we see here? Adductor hallucis. So this is the muscle that's going to help you move your thumb, big toe toward the foot, right? Adductor. And then tendon fibularis longus, tendon fibularis brevis. So by now, you know that there is certain common words we use, right? Longus, brevis, extensor, flexor, minimus, maximus. Those are things. Then you're like, oh, okay. Or adductor versus abductor. So those are the things you can kind of associate when with the muscle or the bone, and then it maybe it'll help you memorize all the parts of the thing, right? Let's look at muscle attachments. Oh, this one we can come back to that later, I think. Okay, insertion. We'll come back to this later. Okay, so this basically brings us to the conclusion of chapter 13. And next week we will do chapters 14 and 15, basically your head and neck, and also the muscles of the torso. And then, no, not next week. Next week is spring break, but week after. Okay, all right. So please study this part.